Go ahead.
All right, we're all good?
We're good.
All right, so hello. My name is Fozan Amjad, and I'm the co-founder of BabySafe Health. Healthy pregnancies are vital to a healthy world, and inequities within our healthcare system threaten the health and wellness of pregnancies for all women, especially women of color. Within the United States, for every one white infant death, 2 black infant deaths occur. And in New Jersey, my home state, our home state, disparity is even worse, where 3 times as many black infants die as white infants. 3 times. This is a result of social determinants, such as lack of accessibility, education, socioeconomic status, and language barriers. And New Jersey and the rest of the world needs a solution that puts information and accessibility in the hands of mothers to empower them during this pregnancy process. BabySafe Health is a Rutgers student-based startup that aims to reduce these infant mortality rates and decrease the racial health disparities by providing mothers with an all-in-one platform to support them during the pregnancy process. Our solution is a free mobile application that connects mothers with a symptom tracker, a doctor's office finder, and a proprietary machine learning algorithm that takes in information from the mother and outputs data-driven insights of the potential health consequences that might occur during the pregnancy. Our solution will give economically and socially disadvantaged mothers the information that they need to feel empowered and in control during their pregnancy process. We have built an iOS application, and we partnered with University Hospital in Newark to bring this solution directly to mothers. And with your support and through partnerships with healthcare providers and nonprofit organizations, we can decrease these devastating infant mortality rates, first in New Jersey, then the rest of the world. Thank you.
Good job. Question? John?
Yeah, thank you. Thank you for what you're doing. Looked at your website. You look better in person. Thank you for being here in person.
Thank you.
2 questions. How many people are using the app now? And what do you think the biggest barrier to getting more folks on it?
All right, so we've developed the iOS application, and we've sort of brought in research from our customer research initiatives with University Hospital. However, we actually want to use a lot of the funding to some of the funding for beta testing to make sure that the solution is efficient as well as tackles the problem that we want. And then, what was your second question?
So, what's the biggest barrier to getting in people's hands?
Sorry, I can't hear you.
The biggest barrier to getting the app in people's hands.
Biggest barrier, it's really just, well, first of all, we want to allocate some of that funding towards an Android and web application to sort of further that development or that scope that we can reach. But the biggest barrier is actually sort of contacting these healthcare providers, contacting these nonprofit organizations, and presenting them with the solution that we have and showing them that the solution is efficient, does tackle the racial health disparities by providing it for free. So that's our biggest barrier, just simply finding that market within the healthcare providers and the current market that we have with the nonprofit organizations, bringing it to them, and then they'll partner with them, and we'll partner with them to bring the solution to them.
Any other questions?
So this is a free cost to the consumer. So is it the healthcare provider that's providing this to essentially lower their costs, or also donations and et cetera?
Yes, certainly. So there are 2 streams of revenues. One you did mention was the donation or the grant aspect of it. But the other part is that we aim to partner with maternal companies, diaper companies, a lot of the companies that are prominent in the pregnancy market as well as the baby market, and providing advertisers for them. We also want to offer ad-free app licenses, of course, but certainly our 2 main sources of revenue are going to be grants as well as ad revenue.
Thanks.
So LabCorp recently just bought a company called Ovia. It's a digital platform, and they were a venture fund company of ours, and so we would be whatever happens here, we'd be very interested in talking with you about what you're doing. Because to John's point, you need to scale this, and that is not easy in healthcare. You have to have a platform to scale with. So just keep that in mind.
We are looking towards partnering with local governments as well, finding the areas of our country. We're starting with New Jersey because that's just the closest, but we do want to scale this to the rest of the United States, and that comes with partnering with local governments, even the state governments as well, so that we can find their respective demographics. And of course, like you said, scaling that is not easy, but certainly it is something within our mind. It is a path that we'll take.
Excellent job. I think you're starting with New Jersey because it's the best, but
Of
great
course.
work.